Welcome to Rochester Lifestyle Medicine Institute's Lifestyle as Medicine lecture series. Tonight, I'm so excited that we'll be hearing from Dr. Kim Williams, who will be talking about preventive and nutritional approach to cardiovascular disease and health inequities. I am Dr. Ted Barnett, the high-tech doctor with low-tech solutions. A lot of you know me as Dr. Veggie. I am the president and founder of Rochester Lifestyle Medicine Institute. It's so great to welcome you all here. And these are our upcoming programs. We start these every month on a regular basis. The Jumpstart program is every month. The Lift project starts regular intervals, and health coaching is available all the time. Just take a look at our website, rochesterlifestylemedicine.org, for more information about that. We have been doing Jumpstart now since 2018. 2,800 people have gone through our Jumpstart, and from 50 states and 11 countries. And we recently introduced the Jumpstart On Demand, which you don't actually have to go to the live sessions, which doesn't work for everybody, especially in different parts of the world and different time zones. So that's now available, and you can learn about both of those if you just go to our website and take a look there. RLMI Community is our friendly community platform, which incorporates events and programs such as this. And there's also special benefits for people who subscribe, but you can have an account there without subscribing. You'll still be able to enjoy some of the benefits. It's only $5 a month if you decide to sign up, and there's a 30-day free trial. It's troll-free and respectful. We love it about that. Dr. Kim Williams, there he is. He's sitting in his car because he has to go catch an airplane, and we're so grateful that he has managed to not go off the road. And he is the chairman of medicine at the University of Louisville. He specializes in general cardiology, preventive cardiology, and cardiovascular radiology. He's a past president of the American College of Cardiology and the American Society of Nuclear Medicine, and former chairman of the board of the Association of Black Cardiologists. As chief of cardiology, Dr. Williams founded the Urban Cardiology Initiative at Wayne State University and the HEERT program, helping everyone assess risk today at Rush University, screening for heart disease and intervening with education, nutrition, and lifestyle medicine. So welcome, Dr. Williams. And I also want to welcome Dr. Schutzow, who's a resident at University of Rochester, and he will be fielding our questions tonight. Welcome, Dr. Williams. It's great to have you here.
Great to be here, and thank you so much, Ted. Really appreciate the invitation, and looking at that, you got a huge audience. This is really spectacular. This is probably the most important thing that we could ever talk about. And people ask me once they realize what it is, why do you keep talking about this? Don't you know it's going to put you out of business? Which is actually repurposing a line that when I was the incoming president of the American College of Cardiology, saying, we in 2 generations should put ourselves out of business. And this is how you do it. Okay, so I will, as Ted talked about, I will mention a bit about health inequities, but this is for all of us. It really is. I won't spend time on the learning objectives because you're going to pick them up in droves. I always show this slide, but the data on it is new if you've seen me talk before, because we're now up to 1 death, 1 out of every 5 deaths, almost 1 million Americans dying every year from heart disease, and we still have the health inequities. Excuse me. I've learned a lot about health inequities by moving from Chicago to Detroit, and then from Detroit back to Chicago, and then Chicago to Louisville. And so that 30% higher mortality rate that you see in African Americans, that's shared by Eastern Kentucky, where you have very few blacks in the Appalachian Mountains. But the dietary patterns are very similar and throughout the South, and that is considered the South. And so you end up with all of the same diseases. So, and here's they are. You might be surprised if you've heard me talk before that I usually show the global burden of disease data. And I was surprised when they redid this and decided that high blood pressure was number 1. Well, I'm not that I'm doubting the impact of high blood pressure, heart, brain, kidney, no question. Okay. But high blood pressure is predominantly dietary. There are very few people who have the pheochromocytoma or a secondary cause that isn't dietary. And renal artery stenosis, what is renal? Well, occasionally it's fibromuscular dysplasia, but most of the time it's plaque. which is dietary. So I'm flipping those, and I'm saying that dietary risk is still number one, and all of our risk factors fall below that. Obviously, tobacco use is something, it's a bane on our existence that we really need to fix. Um, okay, so as it turns out, we have amazing amount of diet-related disease in the United States. We have more Americans who are sicker than ever have been. And as it turns out, we have a preponderance of obesity and liver disease that is hepatic steatosis that's all dietary. And as it turns out, we have amazing amounts of increasing, escalating healthcare spending. And you could go through all those numbers and be appalled at the fact that we're spending one out of every $6 on healthcare. Uh, but just look at the diabetes cost. And so, not all diabetes can be made better by diet, but not all of it can be eliminated because type 1 diabetes is a different lack of insulin antibodies and all of that. But that's somewhere between 5 and 10% of diabetes. All the rest of it is dietary. And so that's what we have to do. And what's on the agenda? Fruits and vegetables. And this has been in our dietary guidelines perennially. And every 5 years, they come out with new dietary guidelines. Well, you know what? There are always going to be, particularly the ones that are coming out now, they're very green. They're all talking about plant-based nutrition as the savior. Now, the question is, what will the final document look like? That I can't tell you, but I can tell you that a plant-forward diet would save so many people. So what are we eating? Was actually characterized really well by the Regards people. Regards was racial differences in stroke study, but it wasn't just about race. It was about dietary food pattern. And that Southern diet, that's a lot of fried food, sweet tea. So the putting vegetables together, but putting animal products in it, like collard greens with fat back. People would call it soul food, but it's been adopted by many people in the South. And what's the result? It's 56% higher risk of heart disease, more kidney disease, more stroke, all of it really associated with the diet. So with that as an overview, I want to spend a little time talking about the individual risks that we have and how we can mitigate those risks of diabetes, hypertension, hyperlipidemia, that's elevated cholesterol, and inflammation. And the best way to do it is to just show you what the endpoint is. This is an old slide from Caldwell Esselstyn that almost everybody who's in this area will recognize. And that's where the talk should end. That is a plant-based diet. And you could argue back and forth about no oil. He never did it with oil. You can argue back and forth about nuts and, the individual components. But you know what? Dr. Esselstyn's diet shares with, Joel Furman or, any Dean Ornish or Neil Barn. What do they have in common? No animals. And so you drop the inflammation, you drop the the LDL cholesterol that plugs up arteries, and you can get reversal of coronary artery disease. And there's really nothing more that we should say. But instead, what we're doing in cardiology is, a lot of techniques to try to improve it or medicate it or stent it or bypass it. And we need to be working on this. Okay, so I'm going to show you a handful of studies that are very, very recent. And this is one of them from our Harvard group that you know very well, Walter Willett, but it also has David Jenkins. And they looked at a lot of data, a lot of patients, 30-year follow-up, looking at the deciles, that is high to low, of protein, plant-based versus animal. And hopefully everyone on this call, you're very high on that ratio. It should be infinite because animal protein is in the denominator, which makes it infinity, I'm hoping. When you have a high number like that, you end up with much lower risk of cardiovascular disease and coronary artery disease. Interestingly, the stroke data there are different kinds of strokes. People actually can have hemorrhagic strokes. Um, And we need a lot more clarity on that. But the classic stroke of hypertension and plaque in your carotid arteries definitely go down. Uh, for diabetes, which is so expensive for us, we have to look at that very carefully. And this was a wonderful study, almost over 500,000 cases. And they were very particular to try to analyze animal versus plant protein, like that ratio. But they did a different approach. Just get rid of some of the animal protein, replace it with plant protein, and see what happens. And the answer was very clear. If you replace 20 grams of animal protein with plant protein, you reduce your diabetes risk by 20%. That's less than the 30 grams in one bacon strip of animal protein. So we can actually do this. Um, we have a veterans population. Since I'm committed to talking about healthcare disparities, the cardiovascular disease rates in the veteran population are very high. And this was one of several studies that they've put out, all showing the same thing. Get rid of the cholesterol. When you drop the cholesterol, you drop the relative risk of having a heart attack. Okay. And so they were focusing on eggs because eggs have about 250 to 300 milligrams of cholesterol per egg, and people are usually eating two or more at breakfast on a consistent basis. When you do that, that increases your risk of MI, that's myocardial infarction, that's heart attack, um, quite dramatically. I should mention the animal fat because we most of our papers always talk about protein and cholesterol. How about animal fat? Why? Because plant fat, particularly if it's monounsaturated, polyunsaturated, having polyphenols like you would see with olive oil, they can actually lower your cholesterol. They can lower your blood pressure. And the animal fats with this high saturated fat content increases your LDL cholesterol as well as your blood pressure. So what happens, and I know this doesn't answer the oil versus no oil, but just so you're clear that if you get rid of animal fat and substitute it with vegetable fat, the mortality goes down substantially. So I threw this one in there just because I couldn't help it. It's something that we're doing a lot in the plant-based world. We're using a lot of soy milk, but there are still some vegetarians, not whole food, plant-based vegan people, who are using cow's milk, which obviously was made to grow a cow. It has a massive amount of growth hormone in it relative to human milk. And so what happens if you substitute it? Amazing. This is a forest plot showing on the left, showing a substantial decrease in all these risk factors. That is your LDL cholesterol, their HDL, triglyceride, everything gets better. Your hemoglobin A1C, a marker of how much blood sugar you have or blood sugar excess, the blood sugar itself, all of it gets better. The only the only outlier was the insulin level, which generates plaque and obesity. You want it to be low. If you're using the sweetened soy milk, that actually can be worse than cow's milk. So let's not do that. All right. So one of the realizations from the recent literature is that cardiovascular health and cancer are really about the same. Seriously. And so if you look at the vegan vegetarian diet, you're going to improve not just your heart disease, but your cancer risk along with every single inflammatory marker. What's so difficult about cancer is the inflammation and obesity. So the plant-based diets really are a way to try to reduce the two leading killers of Americans, and in most countries, those are the two leading killers. How about the flexitarian? I get this question all the time. Doc, can I just have something every now and then? For me, being a cardiologist, sending them to bypass surgery, doing stents and putting people on balloon pumps when they're in cardiogenic shock. I mean, I have enough mental trauma. I never want to be the person on the table. So flexitarian would not be attractive to me at all. And I think this supports my point of view. That is, yes, a flexitarian and vegan diet both lower insulin, triglycerides, total cholesterol, okay, and LDL cholesterol. However, the most favorable result is if you did a whole food, plant-based, vegan, vegetarian diet. you wouldn't think that I would even talk about regular meat eaters, but we need this data because we have some folks in our current Health and Human Services saying that animal-based keto diets are actually good for people. Well, let's just take a look at the data. As it turns out, compare people and look at term risk, okay? For cardiovascular disease, you see that all of the risk factors go down with a plant-based diet, not so much with a meat-based diet. So this is something that we should quote, and whenever someone approaches us with an animal-based keto diet, let them know that they need to put those two terms in a search engine: keto diet mortality. Just put those in, and they'll see all this literature come up. Well, one of the things I've learned, mostly speaking at veggie fests, and I know none of you would be guilty of this, is that, well, let me back up a little and say the number of people who are plant-based is growing. The number of people who are plant-based eating for health is not as large as I'd like it to be. Some of it is, planetary sustainability, and some of it is actually animal rights. And I see all points of view. I know they don't always see it. I mean, the planetary sustainability people, um, would take the animal uh, clothing and keep warm so that there wouldn't have to burn coal. I understand. And then you have the animal rights people who are not concerned about the greenhouse gases so much, as long as the animals are live, are living free, and yeah, there should be loads of them and they're playful. I understand that too. But one of the things that those two groups share, and to some degree even healthcare vegans, is the diet may not be actually good. That is, if you start off with a something that's minimally processed like a carrot, and then you take the fiber away in a juicer, or you mix it with a lot of sugar and a lot of refined grains and make this luscious looking and taste ultra processed carrot cake, you're really going downward spiral into what's unhealthy. And so we do have to think more carefully. And this is the data that really makes me put this little section in, and that is the healthful versus unhealthful plant-based diets and the risk of coronary disease. Again, from Harvard's Nurses Health and Health Professional Follow-up Study. And this is the one you always want to remember when you're at the Veggie Fest and you see the longest line is always um, the vegan cupcakes, and the second longest line is the vegan ice cream. That dotted line that you're seeing on the right, that dashed line, excuse me, that dashed line is more coronary heart disease incidence with an unhealthy plant-based diet than with eating animals. And so it really isn't something that's beneficial for us. Okay, so underpinning this, in case you hadn't heard it, because you're going to hear more and more about all of the cardiovascular risk factors and the effect of the gastrointestinal microbiome, is something that we can control. And yeah, you could take a poop pill. You could have a transplant. People tend to do that from their spouse when they have a problem like Clostridia difficile, an uncontrollable diarrhea, and it does work. But I'm talking about having a dysbiotic microbiome because of eating animal products versus the real prebiotic, which is a whole food, plant-based, vegan, vegetarian diet. If you do that diet, you, in a prospective manner, you see an immediate drop in the inflammation as the LDL and the obesity and blood pressure are all falling, and blood sugar. Okay. And so an intervention like that really should have stopped all questions about how to treat heart patients when Bonita Shah published this, because the inflammation is really important. And you'll hear people say, oh, your LDL cholesterol doesn't matter, it's about inflammation. Well, what they're quoting is Paul Ritker. And yeah, the answer is they're both important. But let's not underestimate the importance of inflammatory risk. What you're seeing here are people whose lipids were controlled, okay, that third bar, but their inflammation was not controlled, and they have twice the cardiovascular risk almost. So that residual inflammatory risk, yes, you can treat it with statins, but you also need to do a whole food, plant-based, vegan, vegetarian diet and stop putting things in the GI system that upset the microbiome, make it dysbiotic, and increase inflammation. And so we have really good data on this, that the microbiome changes everything from insulin sensitivity to lipogenesis. So the inflammation, obesity, diabetes, blood pressure, and a variety of neurologic disorders as well, all are stemming from our microbiome. How do you fix it? Whole food, plant-based, vegan, vegetarian diet. This was published earlier this year. A vegan signature microbes, favorable cardiometabolic markers, and red meat is the type of negatively correlated with the type of microbiome that makes people better. So this I was showing you a bunch of stuff from 2004, 2005, all recent literature, but I'm throwing back one. I'm throwing going back a few years because there was a paper published in 2024 that changed our approach to nutrition, and it was presaged by the study I'm showing you here. This is Frank Hugh, Walter Willett, talking about how bad red meat. Red meat is so bad for you that what can you substitute for red meat and drop your death rate? Okay. And the answer was pretty much everything. Okay. Who won? Soybeans. But legumes, nuts, were all better. And even other animal products were better, except for one. Okay. And that was fish. And for the longest time, I show this slide and ignored that 6%, 1.06, that 6% increase in mortality because it didn't reach statistical significance. But there was a signal there. It's on the wrong side of the plot. And so didn't understand that when it was published 5 years ago, but I think we have clearer understanding now. What is it? March 7th, 2024, there was a big article that made the news about microplastics. It was in the New England Journal of Medicine, microplastics and nanoplastics in plaque. If you have it, you're in trouble. If you don't have it, you're still in trouble, but not nearly as much. You don't want to have plaque at all, but plaque with plastic is a recipe for ending up with a massive amount of cardiovascular events. It's not pretty on microscopy, and the Kaplan-Meier plot is even uglier. This is showing you the cumulative events over time. In blue are people with carotid disease who, when it was pulled out with a carotid endarterectomy, they did not have plastic in their plaque. And then in gold are the people with endarterectomy where there was plastic. And that 4.5-fold increase in heart attack, stroke, and death is more than just about anything I've seen in Kaplan-Meier plot cardiology. So we don't want plastics. Very damaging. So what food has plastics? Mostly seafood. And so shellfish, but also, algae and kelp, anything from the ocean tends to have plastic in it now because we polluted it so much. So try to filter it out. Use the filter on your refrigerator. It'd be great. While this was happening, we still have a lot of cardiologists who are recommending fish instead of red meat. Why? Because of this trial. And I believe it's a misunderstanding of this trial. The authors didn't do it. It wasn't the reviewers and it wasn't the publisher. New England Journal of Medicine is pretty strong and evidence-based. And so when they show this upper left-hand corner, that there was a 30% decrease in heart attack, stroke, and death with a Mediterranean diet that's dropping the red meat and putting in seafood as a substitute, and divide that group into extra virgin olive oil or nuts supplied to their homes, didn't seem to make a difference. Okay. But that 30% decrease in heart attack, stroke, and death, remember, that is a combined endpoint. What about the individual components? Well, they published it very clearly. There wasn't a mystery. And the decrease was the huge benefit in stroke reduction. Changing from red meat to fish, at least back then, maybe we have more pollution now, maybe it won't work. But back then, would lead to a large decrease in the stroke rate. Heart attack, myocardial infarction, was essentially the same in all three groups. Death from cardiovascular causes, essentially the same in all three groups. Death from any cause, virtually identical. So this is not a cardiology diet, unlike so many of our guidelines saying, do a Mediterranean diet. It's just not what the data shows. There is some positive data. It's for secondary prevention after a heart attack, but let's stop first heart attack from happening. And then we can have a much healthier population. Anyway, I really enjoyed seeing their follow-up study about plants, and they were calling it a pro-vegetarian Mediterranean diet. Same data, just turned on its side. Forget about where you were randomized. What did you eat? And the top quintile of vegetable consumption, essentially vegan vegetarian, versus the lowest, had a 42% decrease in the death rate. And so they're calling it the pro-vegetarian. I like the term vegetarian diet. Either way, the message is very clear. Plants save lives. Okay, I'm going to spend a minute talking about kidney disease because it's such an important, largely ignored issue. There's so many people, an increasing number of patients with chronic kidney disease, and for some reason, not everybody is seeing this literature that says is that they are worsening gradually. The inexorable rise of the creatinine, headed from stage 2 to 3 to 4 to dialysis. Why don't we stop it from happening? Because the data is actually very clear. It's been out there for several years that plant protein saves the kidneys, animal protein makes it worse. And so, nice prospective trial with soy protein, taking those stage 3 people, stage 4 people, and making them stabilize and improved. And why? Because it fixed pretty much all of the risk factors. And that's really what we should be doing. So, National Kidney Foundation actually has published this one about a plant-based diet and the risk of CKD, chronic kidney disease progression, and cutting the death rate. All you have to do, get rid of the animal protein, put them on a plant-based diet. So this is one where they talked about, and you may have heard this over again. And I actually just heard it, the lecture at University of Illinois right before mine. You eat animal products, you're getting a dietary acid overload. And that was thought to be the key feature that was hurting the kidneys of people with chronic kidney disease. They couldn't handle it. Turns out someone very brilliantly said, well, we could fix that. Just let them eat what they want, but we give them bicarb. And that's to stop the kidneys from getting worse. It didn't work. What worked? Fruits and vegetables. So same message, get rid of the animal protein. National Kidney Foundation is asking everybody to do it. Not sure why it's not happening, but please, for everyone you know, let the doctor know about this literature. Just Google those 2 words, CKD vegan diet, and all of this massive amount of literature will pop up, and hopefully they'll change their practice. I do want to mention COVID again. I had retired this slide, but you can see that recently the rates were going up again, and it's certainly getting a lot of states in the United States. And so just remember that a whole food, plant-based, vegan, vegetarian diet is the best thing you can do to decrease the likelihood of having a moderate or severe illness with COVID, 73% reduction. Pesco vegetarian actually worked as well. The animal-based keto diet made things worse, a whole lot worse. And so please make sure that everybody you know who is doing a keto diet knows about this data. Just keto diet, COVID, mortality, that kind of search. Give them all the information to stop them from doing that. There was a more recent report that actually said that COVID incidence was lower with vegetarian diets as well, about a 40% decrease you're seeing over there. I'm going to spend just a moment talking about the Anthropocene, and the whole idea that you know, maybe we should care for the planet that we live on, and could we actually improve our health at the same time that we're taking care of the planet? And it turns out that unhealthy diets are hurting us and hurting where we live. The Planetary Health Diet Index is very striking data from very large cohorts analyzed for what they're eating to help the planet, which is mostly plants. And the answer was 23% decrease in death if someone followed what was good for the planet. Okay. And so this is another way of looking at it. And so there's so much robust data going in this direction that Lancet now has a planetary health journal, and it's saying exactly the same thing. Get rid of the processed meat, get rid of the unprocessed meat. You just reduce it to some degree, and you're going to improve the planet, and you're going to improve the risk of diabetes and heart disease, colorectal cancer as well. So I I had not paid attention to planet until I had my ninth grandkid. Then all of a sudden, I started thinking about it. A little late to it, but now I'm focused on it because we have so much outcome studies that talk about the same kind of thing. This is UK Biobank and Inhanes saying that cancer, but also respiratory disease mortality. But all-cause mortality, cardiovascular disease, cancer, um, uh, stroke, diabetes, all of them get substantially reduced if we were to do a plant-based diet. Back to the Million Veterans Program for a moment. I want to be very clear that this is one of our healthcare disparities. People who have risked their lives in service for their country, and they come back and they have a lot of stress, cortisol levels, epinephrine, blood pressure, poor diet, substance use, putting them at cardiovascular risk. And the bottom line is fix the diet and your cardiac events plummet. People look at this and say, well, why is it a steeper improvement with the African American population? Well, that's because it's a hazard ratio and our diet is worse to begin with. And so making this change helps everybody, but it really makes a difference in the African American population. So anyway, this is a plug for the Journal of the American Medical Association. Really glad that they published this a while back. Hopefully, everybody saw um, the Netflix documentary about this, the twin study, looking at what happens if you take uh, identical twins, 21 pairs, and randomize them to 8 weeks of diet. Okay. And the fact of the matter is, when you went on the vegan diet, you saw just what you would expect, a decrease in all the cardiovascular risk factors. Okay. And B12 as well. But also the aging stopped. So the younger twin is now the vegan twin. Okay. So it's hopefully everybody has seen that data and let's spread the word. Not that we have the fountain of youth, but more youth, more vigor is what happens when you have a whole food plant-based diet. Okay. So the end of I'm going to open it up for discussion in a few minutes and then run to the CSA security. But I want to just tell you that we were looking at how well we're able to change physician nutrition, and it's really tough. And I'll show you some data in that regard and maybe some progress. But after one of those publications, I was so outdone by the fact that we hadn't gotten physicians to follow guidelines. And it took us a while to get beta blockers for heart attack, and it turns out to be wrong. But uh, it took a while to get statins into common use, but it gradually got there. But we've been at this plant-based nutrition thing for quite a while, and we just have not gotten the uptake that we need. So whenever I have any kind of problem, I actually go on ChatGPT and see what they have to say. Okay, so here's the question for ChatGPT. If plant-based diets are associated with lower death rates, lower chronic disease, and that of course means dramatically dropping our toxic levels of healthcare spending, help sustain the planet, avoid animal cruelty, why aren't they widely adopted? And it very wisely gave me 10 different answers, each of which, if you wanted to go back to, shameless plug for an International Journal for Disease Reversal and Prevention that I'm the editor of. And so this editorial slash data is about ChatGPT's response. Culture and traditional habits are very tough. Long-standing culinary practices are hard to break. We tried it on the south side of Chicago. It was actually highly successful in Obama's old church on the south side. We actually gave them 5 weeks of food delivered to their house, asked them to not anything else, and reported if they did. There was like an 93% adherence and dramatic reduction in all of the risk factors. It actually worked really well, pre versus post, LDL, insulin levels, trimethylamine N oxide. Please write that down if you're not sure what it is. But ultimately, the question was, um, we made a difference or we made a change, but did we make a long-term difference? Only in about a third of people, even though they saw their risk going down. A lot of them went back. Well, we have data on that. That is, our cardiovascular disease and renal disease overwhelmed. I didn't mention it in the renal section, but and some of you know this, but Blacks are in the United States are 12% of the population and 35% of the dialysis patients. It's hypertension, diabetes, and diet outcomes of red meat. And so, if you change to a plant-based diet, you can reduce mortality significantly just by doing that intervention if you can get people to stick to it. Not easy, but that's really our job. Taste and familiarity. Well, your tastes are formed in the mother's womb, and it takes, a few weeks to change and start liking some of those plant-based things that you thought you didn't like. If you're not eating animal products, your taste buds change. Accessibility and affordability, that's one where I had a little bit of an issue. And they said that the data is sparse. Well, I went back and got the data. If you take a look at whole food plant-based items, like for protein, let's say, beans, grains, nuts, seeds, okay, mushrooms. You can actually buy a lot of those things in bulk, okay? And when you do that, it's really inexpensive compared to animal protein. Nutritional concerns, that one's real. You saw how the B12 level dropped in the You Are What You Eat twin study. Well, that's because B12 is in the dirt. We wash our vegetables. Cows don't. And then people eat a cow and they get enough B12. Well, how about, so if you're not going to eat a cow, you're not going to eat the dirt, just take a B12 supplement. And that's what I certainly would recommend. Social norms and peer pressure, it's really important to try to fit in with people. And vegans are always, the person who's, evangelizing because of what they really believe. And they're right. But we have to somehow not cave to the peer pressure and use it as a teachable moment. Marketing and industry influence is a one that I've been dealing with, and lack of education. I think that they go together. We actually published a study, and again in IJDRP, about marketing mortality, because that's essentially what it is. 104 television commercials about food, 58% of it was fast food. What that means, the refined grain on the burger, the burger has cheese on it, um, the the ketchup is high fructose corn syrup, the soda pop is double size, and the potatoes would be healthy if they hadn't been deep fried, but they are. And so what we recommended is that we have um, congressional legislation to, just like we had in 1973 for cigarettes. We got nowhere with that. And I'm hoping that folks will continue to take this up and not advertise to children, and be careful because it increases our healthcare disparities. Who watches television the most? People in poverty. And so then they have the healthcare consequences because the marketing works. Okay, so that is our, inner city nutrition. The question is, are we any better with physicians? And this was the article in IJDRP that sort of made me want to do that ChatGPT thing that I'm talking about, because we've met the enemy and he's us. And it turns out that out of 274 academic institution physicians at Rush and Loyola, one plant-based person out of 274, seriously, very disappointing. And you look at some of our medical meetings, and this one happens to be a couple years ago, the American Society of Preventive Cardiology. And I called them out on it, and they haven't invited me back. But that's okay. But the just so you know, I didn't mention it because it's kind of off topic, but bacon and sausage are both processed meats that had that highest mortality benefit if you substitute it with plants. And if they're so-called World Health Organization Group 1 carcinogens. And so why would we do that? Okay, so and then there's the eggs with all the cholesterol. So I've shifted a little bit to try to be more in line, not just whole food, plant-based, vegan, vegetarian diet all the time, because there are other things. They're just tiny in my view compared to the rest. But there are 6 areas where people could improve their health. And this is from the American College of Lifestyle Medicine. And we actually did a study that was published just a few days ago or few weeks ago um, about the ACLM six pillars and cardiologists. I'm happy to say that the number of whole food plant-based diet folks was actually much higher than it had been in the past. And so 8%. But more importantly, I was impressed that 41% were recommending it to patients. Now, that's 59% not understanding the data clearly, but but we're doing better. More um, uh, more people were recommending that than were avoiding alcohol, although this was done right before the alcohol causes cancer thing that came out in January of this year. Emotional attachments are big, getting towards the end of our list. And convenience and time constraints are huge. It's very addictive mentally and emotionally to give up things that people have been eating and have positive associations, not realizing what damage it's doing to their body. And then I've got a soft spot for the fast food that because it just irks me that you pay them to make food that makes you sick, and then you pay a healthcare provider like me to take care of you and then go back and do it again. And so I actually asked artificial intelligence to just model it out for me. What are the industry profits? And then what is the direct and indirect costs when you consider healthcare? And they're saying this whole thing, this whole fast food thing is about $1.5 trillion that we could save if we stop doing that or demand that they serve healthy food. If people didn't buy unhealthy food, they wouldn't serve it. They're not in the healthcare business. They're in the keep their restaurant open business. And so let's do the education that's necessary. Okay. Another issue that we published earlier this year is that we have a lot of unhealthful plant-based. I mentioned it before. Uh, how can you go to a place where an omnivore restaurant with vegan options or a vegan vegetarian restaurant and actually get a decent number of entrees? Well, a little bit more in the vegan vegetarian than in the omnivores, averaging 4 versus 2.4. But we need to have more restaurants that are paying attention. Now, what's healthy? What do we mark off for? Fried food, saturated fat. That's like curry in an Indian restaurant, and refined grain. Refined grains are everywhere. You have to look at uh, the every dessert is typically sugar or refined grains, and they're everywhere. And that's because people are buying them, people are loving them, and it's hard to stop. And so we're fighting an uphill battle when it comes to unhealthy plant-based food. Okay, last, resistance to change is it's hard to overcome inertia and get people to realize the benefits for them and their families and for our society. I try to tell people that, I would never call somebody out for not being a patriot, but when you look at the data and what's happening in our country, you have to question if people are not being thoughtful about what's going to happen to our country down the road if we don't make some changes. Okay. Uh, this is in the last slide or the last part of that article was where AI gave me this really wonderful, inspiring couple paragraphs that over time and education awareness continue to spread, likely that adoption of plant-based diets will become more widespread and that everyone's going to recognize the health and environmental and ethical benefits. I'm pretty sure that this is an AI hallucination, but I'm hoping that it's right. I'm going to end, and I know it's a few minutes early, but I want to give you enough time to talk, to ask questions. If and this became my summary section. I had a whole summary prepared, and then realized that this says it all. So I actually asked, knowing that ChatGPT knows the entire world's literature. Okay, answer the question: if you had a body, what would you eat? And what it says is, maximizing personal health, planetary sustainability, humane treatment of sentient beings. I'd eat a whole food plant-based diet. Okay. Why is that? Cardiovascular disease, type 2 diabetes, hypertension, certain cancers, LDL cholesterol, inflammation, insulin resistance, and the gut microbiome. My goodness, that's my talk right there. And yeah, it does list the TMAO and the heme iron. No question about it, that the things would be better. Now, it also went on about planetary sustainability, that we all should be more concerned about deforestation and biodiversity loss and water usage. And maybe at some point we'll start to consider what is happening to the animals who are suffering with the current American diet, and rejecting systems where sentient beings are treated as expendable commodities. Encourage more empathy, and maybe we'd have more empathy for each other if we treated the animals that way. Okay, so anyway, I think that gave as good a conclusion as I possibly could. I think ChatGPT is just really good. All right, so with that, I'm going to end, and I will open it up for questions.
Great. Thank you, Dr. Williams. We're getting a bunch of little hearts rising up out of the ether here, and they loved your talk. So here's our resident, Dr. Jack Schutzo, who's going to be fielding the questions. What do we got?
Awesome. We've got some questions rolling in, and more are welcome to come. One common question is, Dr. Greger recently commented about the importance of lowering one's LDL, but some people are curious, how low is too low, and when do the risks outweigh those benefits?
So we don't really know the answer to that, except in young Chinese, not Japanese, but Chinese women, not men. There was data saying that an LDL less than 25 would be associated with increased hemorrhagic stroke. It hasn't really been reproduced in other populations. And the cardiovascular mortality, cardiac events, stroke, all of it actually goes down. And the people are talking about, I mean, we're just getting used to having an LDL less than 55, which was down from 70, which was down from 90, which was down from 100. Well, and now people are saying, A, lifetime lowering. Okay, so we should be starting statins and plant-based diet. If anybody has any genetic predisposition to higher cholesterol, start it early and give it often. But shooting for a target of 25. So yeah, we used to think that if you didn't have cholesterol, your brains would fall out or something but it turns out that everything that's in the serum is extra. And babies grow their brain just fine with an LDL of 10 or 11.
Great. Actually, just a comment. So our son, who's been vegan since before birth and is 33 now, his lowest LDL was 15, 1.5. It's up to 20. It's up to 20 now. So
So interesting. When you get below 20 naturally, he may
yeah.
have PCSK9 deficiency, which is where those drugs came from. They found those people in the Dallas Heart Study
Okay.
who had single digit LDLs. It could be a spontaneous mutation, but you can check you and your wife. And in
Okay.
fact, it's lifelong protection from coronary artery disease to have an
Right.
LDL that low. If you did that with diet, that would be really spectacular.
Right. Yeah, we wondered about that. Thanks. Jack, what else we got?
All right, so a couple of more questions regarding microplastics. People are
Mhm.
curious, how does one test for these dangers in their own bodies? And like, should you avoid seaweed in addition?
So the first part, that's New England Journal of Medicine study. If you pull it up, you'll see that was, like I said, carotid endarterectomy samples. And so, the autopsy is the most accurate way. Let's avoid that. Okay. Okay. And so I don't know that you could do anything to diagnose it necessarily easily, but you certainly can prevent it. Turns out, and just study it. Just ask the question. You have artificial intelligence. You have Google Gemini. Google Gemini says that those little filters that you have on your refrigerator, they actually work to get rid of the plastics. So absolutely, it's worth investigating. And the other answer is, yeah, I had to give up my omega-3. Joel Furman talked me into those omega-3 because as long as it's plant-based, I don't mind. Yeah, and it was from algae full of plastics. And so I end up going online, finding a brand where the plastics it were either lab grown or plastics were removed. I think it might have been lab grown, but bottom line is it cost me 3 times more. And that's fine. I don't want the plastics.
Interesting. What else, Jack?
So someone's cardiologist is unfortunately retiring and they follow, a whole plant-based diet. They're wondering what questions you think would be important for them to ask new prospective cardiologists.
So, so uh, if to be honest, it would be how willing are they to follow ACC/AHA guidelines on every aspect of cardiovascular care? We have lots and lots of guideline gaps, let's call them kindly, and uh, and not adopting whole food, plant-based, vegan, vegetarian diet is one of them. It's now gotten to the point where diet and exercise are at the beginning of pretty much every ACC/AHA guideline. Okay. But people still see a hypertensive and write a prescription, see a cholesterol elevation and write a prescription. What they're supposed to do is 3 to 6 months of lifestyle change first, unless you've gone, obviously beyond the limits in the guidelines. More than 140 systolic, you should just start therapy. More than 190 for an LDL, just start therapy. But you do that therapy with the lifestyle changes.
Good to know. Good to know.
Yeah, here's a quote. Go ahead, Jack. What you got?
Oh, someone was just curious about your thoughts on kombucha tea.
So it's fermented, which means that it has a lot of benefits that I can't stand the taste of fermented tea, fermented anything. So I was very glad to find a study that said that fermented stuff does not do any of the things people thought it was doing. So I don't do it. And you should see what happens to my face when I try to drink alcohol. It's like, oh, it's like I just spasm. So nope, not a big deal. But please feel free to send me any data. Um, that it has any positive outcomes, including GI microbiome, which it had been touted for before.
Mhm.
I'd love to know it. I'm always looking for literature and trying to grow.
Great. There's a question here that I think is interesting. It's about ketogenic diets, and it looks like it's from someone who's a psychiatrist. I have patients who feel better on a ketogenic diet, usually neuro or psychiatric symptom control. Is there data or
Mhm.
ongoing research comparing vegan ketogenic diets to animal-based ones? Do you think this can be helpful?
So the Sarah Seidelman article did talk about a animal-based ketogenic diet increasing mortality by 18%. And a plant-based ketogenic diet decreasing mortality by 18%. I obviously don't do psychiatry. I do know that there are kids who have amazingly better outcomes with their seizure disorder with a keto diet that's animal-based. I don't know if a plant-based one would work, but already because it's been around long enough for people to recognize that they are putting themselves at cardiovascular risk. So see.
Interesting. Jack, what else?
Someone is wondering about the long-term safety of a whole food plant-based diet for children, and if this is a okay recommendation. And then someone else is curious about what your best snack recommendation would be for this kind of population.
Mhm. So on the QT, that's a pun. It's cuties. There's another name for them. What are they? Not
Oh,
orangellos.
tofuti cuties?
No, the little tiny oranges.
Clementines.
Clementines. There you go. Thank you. There you go. And they're kind of like they open up like a tangerine would. They're like a cross between a orange and a tangerine or something. But anyway, cuties. That's my favorite snack. And so it turns out that fruit, unfortunately, the problem is that, as like some plant-based athletes, you tend to lose weight really easily. And so I have to be careful with them because they do suppress appetite. So I have them like right before I go to bed. It actually improves, insulin sensitivity and the like, having fruit before bed anyway. That's a good
Hmm.
idea. So that's the second part of the question. First part of the question, that's a Ted Barnett question. Yeah, so I was
Sure.
not successful in having a plant-based household growing. There was no red meat in the household, but back then I was following the American Heart Association when the kids were small. Fish, chicken, no skin, not fried. Yeah, it sounded really good until I found out that my LDL skyrocketed. It's a genetic condition that happens. Normal cholesterol, 20s and 30s, rapid climb in 40s and 50s, and putting
Mm.
people at extremely high risk. Fortunately, I found out about mine at a American College of Cardiology meeting in March 2003, the day that David Jenkins' uh, the diet, portfolio diet was published. Whew.
Mm.
Okay, and so I went on a vegan diet that day. 6 weeks later, that LDL of 170 was down to 90. So it's so I haven't done it lifelong, then but I know Ted has had some success doing that lifelong. Yep,
Right,
for
right. Well, my wife gets credit for that. So we have three
Mhm.
kids, three kids in their 30s, and we've been vegan since 1991 after reading Dean Ornish. So
That's fantastic.
yeah, yeah, thank you. I know that Dr. Williams is going to have to get off in a couple of minutes. I'm going to just make an executive decision here. Our staff will stick around if there's any more discussion for a few more minutes. So we'd have Dr. Kerry Graff and Dr. Susan Friedman who can come live. And Dr. Williams, thank you so much. We really appreciate it. Do you have any last words for us?
So, it's really good to see you all. I really appreciate it. What I would hope for is advocacy. We've got a couple things going on. For the final comments, the dietary guidelines for Americans that I mentioned briefly. This is a very serious. If you look at that document, it is as plant-based as it's ever been, and then industry will get a hold of it, and they will try to change it. So we need to try to call your senators and congressmen and say, the people got together and they put the science on the page, and that should be the guidelines for Americans. Keep it green. So if you could do that, that'd be great. And the other one would be, my favorite topic of getting television commercials away from kids. We could do so much more with advocacy than we're doing now.
Right, right. Great. Well, thank you so much, Dr. Williams, and travel safely.
Absolutely.
Bye.
Appreciate it. Thank you so much. All right. All right. Bye-bye.
Bye. Any pressing questions in there, Dr. Schutzow, that we think we should address? We'll go another 5 minutes or so, I think.
Some people were just talking about the struggle of the ongoing behavioral changes and, what keeps you motivated to keep this up and working towards these goals for following a whole food plant-based diet.
Yeah. Dr. Graff, do you want to talk about that? I know you've got experience with that.
Yeah, I think the biggest thing is focusing on what you love and want to be healthy and around for. So many of us adopt a diet change because something bad happened, either to ourselves or someone we loved, and we're really making change out of fear. And fear is not a good motivator for more than, 2, maybe 3 months. And then you either get so anxious or so depressed, focusing on, this bad thing's going to happen if I don't eat healthy, that you either basically just don't care anymore because it's just this is making you miserable thinking about it all the time, or you stick your head in the sand and pretend it's not really happening, in which case you don't follow the diet either. So it's really focusing on what your big motivators are for making the diet change in the first place. I did want to add something on to talking about doing a whole food plant-based diet for life. We didn't really focus it hard in this talk. But you don't want to do the very low fat version of this if you're pregnant, if you're breastfeeding, or for any kid under age 2. So you need a higher amount of fat in the diets for those. So you can still do whole food plant-based, but I wouldn't recommend doing an Esselstyn style diet if anybody's got those conditions, because babies need higher fat levels in their diet for brain health. So
Great.
um,
Thank you. Thank you, Dr. Graff. Dr. Friedman, you want to comment on that question that was about, what was
No,
the
I,
question,
I,
Jack?
I think
Uh,
Dr. Graff covered it well.
okay.
Yeah, I think you know, moving towards something positive rather than away from something negative is always a better motivator.
All right. Thanks for that. Jack, we have we have time for one more, Jack. What do you think?
Some people were wondering about, just dietary recommendations to continue to lower one's cholesterol and the frustrations in following a whole food plant-based diet and still having elevated cholesterol and what numbers really indicate maybe I should start a statin.
Mhm. Well, for one thing, if we highly recommend people try our 15-day whole food plant-based jumpstart, unless they're pregnant or nursing or have or 2 years old or younger. That's a tip of the hat to Dr. Graff. But from almost everybody else, it's really worth giving it a try. That's probably the best chance you have at lowering your cholesterol with diet because it follows the Esselstyn protocol. We do offer, after people are through the 2 weeks, we do say it's, you can experiment with adding back in some high-fat whole plant foods, seeds and nuts and avocado and olives. But that's a great way to get started. I don't know, either other doctors on the call want to comment on that? Just the dietary ways to improve your cholesterol?
I think, one thing just to mention is just to keep with it, so we do see these very substantial changes in 2 weeks. If you start with a cholesterol over 200, on average, you have a drop of about 47 points. But the longer that you continue with that, the more that you're likely to see changes over time. I mean, it may not be as dramatic as you go further out, but there because of changes with weight and so forth, sometimes it just does take time to see those changes.
Right.
What I have tend to see is that if you've got a lot of weight to lose, you're gonna, as you lose that weight, you see it further come down. If somebody's thin to begin with and they do their 2 weeks of whole food plant-based low fat, I don't see them continuing to drop so much later. I don't know whether, Dr. Friedman, you've had the same kind of experience, but it's usually, you'll see further drops really just with the folks that are still losing weight, that still have weight to lose. And whether we're seeing some higher levels, partly because you're mobilizing that cholesterol as you're kind of clearing some of that. I'm not absolutely positive kind of what the mechanism is for that, but that's kind of what I tend to see with patients. I don't know if there, I don't think I've ever seen a study that actually addresses that. Have you?
No, I mean, we would love to get some more long-term data to look at changes over time, but yeah, at this point, no.
Yeah. So, for whoever it is who is struggling, that they're really following this, they're being really diligent, and their cholesterol is not where they want it to be. The part of cholesterol is genetic, and it may not be your fault. I strongly believe that lifestyle medicine, that whole food plant-based diets are the strongest medicine that I've ever used in practice with patients. That said, it doesn't mean that you don't want to use the other toolbox that you've got, right? And so you need to look at overall risk, and if it's going to reduce your overall risk by adding in a statin, I would do that. And your doctor can use a calculator based on your various conditions and numbers to kind of actually put in what your risk is, and then add in, if you add in a statin, if you lower your blood pressure more, how much that reduces your risk. So you can kind of see what you're buying for what you're taking, and whether you want to do it. And one of the things that we run into is some people say, well, if I got to take a drug anyway, why am I bothering with this diet? And what that for me is like, well, you've got a cholesterol problem already. Why would you eat more cholesterol, and why would you be eating a lot of saturated fat, which your body's going to make into cholesterol? It's like, if your house is on fire, why would you throw gasoline on it? I mean, you need something to put out that fire that's different from just your diet, but why make it any worse? So I just encourage you to, use all the tools in the toolbox, and definitely don't feel like since it didn't do everything, well, you're not going to bother doing it at all.
Thanks for that, Dr. Graff. Thanks, Dr. Friedman. I just noticed we're getting some great comments on the chat. We have the world famous Dr. Robert Brakey putting in the Gregor protocol there. And so thanks for that, Dr. Brakey. I'd also like to comment to Melanie Coker. I think that's how you pronounce your name. And she says, in Jumpstart, have you all seen a sizable difference with no nuts or oil? And the answer is we tried it once in an early pilot group, and we had the sense that it made a difference. It's because people just did not do as well as the previous group. We have not done a randomized controlled trial, but you know what, Melanie? You can find out in 2 weeks. You just do the diet, get your bloods done before and after, because really, who cares what the average result is? You want to know what your result is. So, right. So I would say just give it a shot. And yeah, and it looks like Yanni Robinson's decided she's gonna, or they're gonna try to take, considering taking the jump start. So anyway, listen, thank you all very much. Thank you, Jack, for fielding the questions. You did a great job. You could be an FM announcer with that voice of yours. Thank you so much, Dr. Graff and Dr. Freeman, Kim Taylor in the background, great engineering. And thank you all for coming tonight. So we're going to sign off. Good night. See you next month, or actually next week, from Lifestyle Medicine Grand Rounds.
Right.